everyone. I am your instructor, Dr. Junaid, MD, and today our topic of presentation will be on anatomy of male urethra, where we will discuss about the divisions of the male urethra, and we will describe various parts of the urethra. On introduction, the male urethra is a fibromuscular tube approximately 18 to 22 centimeters long. Unlike the female urethra, it serves as a dual function. It conducts urine from the bladder to the exterior and also acts as a passageway for semen during ejaculation. Then we will look towards the divisions of male urethra. The male urethra is divided into basically four main parts. First of all, the preprostatic or intramural urethra, secondly the prostatic urethra, thirdly the membranous urethra, and lastly the spongy urethra, also known as penile urethra. Each division has unique anatomical features and clinical importance. First of all, we will as you can see in this picture, this picture is showing the various parts of the urethra right away, starting from the urethral meatus. First of all, there is penile urethra, then there is bulbar urethra where ends and bends are present, then there is membranous urethra which is passing through the bony ring of the pelvis, then there is verumentanum, and then there is prostatic urethra, and then there is bladder neck, and then bladder neck is opening into the urinary bladder. So this is the exact picture showing the anatomy of the male urethra. Then we will discuss about preprostatic urethra. The preprostatic urethra is about 1 centimeter long and lies within the bladder neck. It is surrounded by the internal urethral sphincter, which plays a key role in preventing retrograde ejaculation into the bladder. Second part is prostatic urethra. The prostatic urethra is 3 to 4 centimeters long and represents the widest and most dilatable part of the urethra. On its posterior wall is the urethral crest with the seminal colliculus or verumentanum, which is an important landmark during the prostate surgery. Openings for the ejaculatory ducts and prostatic ducts are also found here at verumentanum, making this part highly significant in reproductive functions. So whenever we are doing the resection of the prostate for benign prostatic hyperplasia, carcinoma of the prostate, we spare this area of verumentanum. This picture is showing the anatomy of the prostatic urethra. Prostatic urethra, and before prostatic urethra there is a part known as verumentanum where ejaculatory ducts are opening. Then there is membranous urethra. The membranous urethra is the shortest, about 1 to 2 centimeters, and is the narrowest and least dilatable portion. It passes through the deep perineal pouch and through the bony ring of the pelvis and is surrounded by the external urethral sphincter, which provides voluntary control over the urination. This picture is showing the membranous urethra. Location of membranous urethra in this circle area. Like you can see that it is passing through the bony ring of the pelvis through the deep perineal pouch. Next we will discuss about the anatomy of the spongy urethra or penile urethra. The spongy urethra or penile urethra is the longest part, around 15 centimeters long, and runs through the corpus spongiosum of the penis. It has two expansions, proximally the bulbar urethra and distally the navicular fossa located in the glans penis. This part is prone to trauma during catheterization. As this picture is showing the anatomy of the penile urethra, which contains the corpus spongiosum, and in between the corpora cavernosa. Corpora cavernosa surrounds the corpus spongiosum, and this is the this corpus spongiosum is a spongy part. Next is external urethral meatus. The external urethral meatus is the terminal opening at the tip of the glans penis. Interestingly, it is the narrowest point of the entire urethra, and this has clinical significance in cases of obstruction or retention or during instrumentation. Then we will discuss about blood supply and innervation of the Urethra. The urethra receives blood from the prostatic branches of inferior vesical and middle rectal arteries as well as the urethral and dorsal arteries of the penis. Venous drainage occurs via the prostatic and dorsal penile veins. Innervation comes from the prostatic plexus and the pudendal nerve, allowing both autonomic and somatic control. This picture is showing the blood supply of the urethra. As you can see that there is dorsal penile artery, then there is bulbar artery, urethral artery, penile artery, and all of these are branches of internal pudendal artery. And this picture is showing the innervations of the urethra. Like you can see that sympathetic nerves which are supplying the urethra, like hypogastric nerve, hypogastric ganglion, and through the sympathetic chain, and then there is pelvic nerves which are supplying the bladder, and you can see that pudendal nerve has 2, S3, S4 segment, giving the somatic innervation to the penis or urethra. Clinical correlations. Clinically, the male urethra is prone to strictures, which can obstruct the urinary flow. Traumatic rupture may occur, especially at the membranous urethra during pelvic fractures. Catheterization may also be difficult due to its curves and narrow points. Urethritis, often caused by infections, is another important condition affecting the urethra. And traumatically, during the pelvic fracture, the urethra damage during stridal injury is the bulbar urethra, and urethra damaged with the pelvic fracture, pelvic bone fracture, is the membranous urethra. And in injury of the membranous urethra, there will be high riding prostate on DRE, digital rectal examination. Thank you very much. For any query, you can contact me on my given WhatsApp number. Best of luck to all of you. Thank you very much for listening to me.